Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning again.
Yes, good morning. So we were talking on another show about addiction, and Dr. Mencia is a great diagnostician. And I was asking him, when a person comes in and they're a patient or they're just starting to be a patient, how do you detect if they have addictions? And you were saying that you ask them, why don't you make believe that I've just come in there how would you treat me?
Well, I want to know if you smoke, first of all, or not.
What if I lie?
The person can lie. You know, it's a bad thing to do if you go to a doctor. The person can lie to the doctor. And
because
say,
they're ashamed.
They are ashamed. But then you look, there are certain signs. For example, if you look at the finger where the person holds the cigarette, they have the nicotine there in their finger. You know, if you look at their face, the way the muscle and the wrinkle develop on the face, it shows that the person, you know, was or is a smoker. When you get close to the person, the clothes is impregnated with nicotine, so you can pick that up when you are examining the person. So the person can lie, and you leave them alone. You know, you have to be at the right time, and they have to develop that trust and confidence on you. And the same thing with the alcoholic. The difference between the alcohol and the liver and the lung is, unfortunately, for the lungs, we have no blood test we can do to see how your lungs are doing. You know, we can insinuate, let's say, by checking the saturation when we put the little pulse oximeter machine on your finger to see how much oxygen you have. It tells us if there is damage in your lung or not, but there is no blood test we can do. We can look at the acid base, because the lung have to do with oxygen exchange. So carbon dioxide, which is a waste material that is produced by metabolism, is supposed to leave our body through the lungs. So if the person is a smoker, they will retain carbon dioxide. So, you know, when you're talking about prevention, there are very little tests we can do. We can do a chest X-ray. We were talking about chest X-ray. But chest X-ray, by the time it detects, you know, lung damage, it's like trying to do a X-ray of your bone to see if you have osteoporosis. By the time the X-ray is so weak in making the diagnosis that by the time you pick it up, it's too late. For the liver, it's different. The liver, we have plenty of tests we can do, and it's very interesting that for the alcoholic, the way the liver enzyme changes are very particular, very specific. Let's say if a person has hepatitis, those enzymes will change in a different ratio than the person with liver disease. So we can pick it up from there. So when we ask the patient, do you drink? And they say, no, I'm a social drinker. But then you examine the patient, you know, they have that flush on their face, and disinhibition sometimes with the scum. And you can smell the apple cider, you know, smell coming out of their breath, you know, that is produced by the process of alcohol in the liver. So you put all those things together, you know that this person probably is an alcoholic. And when we are addicted to anything, gambling, alcohol, or anything, you know, we manipulate everybody around us. So, you know, then education kicks in to let them know that, you know, once we do the blood test and all of that, then we say, you know, look, it looks like you have damage from the liver, and it seems to be from alcohol. It's an alcohol-induced damage, what you have. And there are, you know, we can help you, we can work with you, but you have to be willing to be helped.
Okay, so let's jump now. So that's alcohol and, you know,
cigarettes.
And cigarettes. Now let's go to what you were saying about people now who are over-medicated and Opiates.
Opioid.
Yeah. Let's
Yeah.
talk about that. So how do you know that?
Well, with opioid, it alter your mentation. When you take a painkiller, it will alter your mentation. You can not process things. You are not as alert as
But
the
how
person.
do you know that when they first come in to you're having a consultation?
Well, when you do the blood test and the urine test, you can do a screening when you are suspicious. So if a person is too disinhibit or sort of drug out, and you are not comfortable with the person, what you are perceiving from that person, we don't have to get permission. We can just take a urine test and run a test because we are suspicion. Especially opioid. It have to be, and we prescribe. We have pain management. We have Dr. Marrero that had been to the show. We have pain management physician that work with us. I prescribe pain medication. I'm one of the few doctors that get a national license to write Suboxone. And Suboxone is a medication for people that are dependent on opioid, that want to get off the opioid. They want to switch. Before we used to use methadone. Remember, we used to have all those methadone clinics. Now we have Suboxone, where you have to get a national license, a federal license, to be able to prescribe. And there are few doctors out there. I'm one of the doctors that have taken all the training to be able to prescribe Suboxone. We just lost Prince, an excellent artist, and it's been. The rumor is up there that it might have been in.
Yeah, because they're doing the autopsy. They found those medication, but they don't know.
They don't know yet. We don't know exactly what transpired, but we know that he was dependent on opioid. He was using opioid, and they found a high quantity of opioid. So when we prescribe opioid to the patient, there are certain regulations we have to abide by, and. The amount of pain medication that I can prescribe as a internist or geriatrician is not the same like Dr. Marrero, who specializes on pain management. So I usually tell my patient, if you want more quantity, I don't care if you are Prince or not, if you want more quantity, you have to go to a specialist. If you want Xanax, we can prescribe that. If you have one high quantity, you have to go to a psychiatrist to be able to prescribe that. And but then you have the patient. So if you are on opioid, if opioid is in your system and you have a written script by a doctor, you are okay. If you are getting opioid from the street or you are taking it from a family member, and a lot of people don't know this. If the police stop you and they bring you to an emergency room and they do the test and you are positive, then this question is going to be, where did you get your opioid from? Oh, I bought them in the street. That's a felony. You're going to jail.
Well, let's wait a minute. Let's get the word opiate. So what are name some things?
Percocet,
so something
Vicodin,
like Percocet.
Percocet.
Like you go to the dentist and
when you go to the dentist, right?
And that's an opioid. Opioid. How do you spell that?
Yeah.
I don't even know. Opioid.
O-P-O-D. O-D.
So it's a
opioid.
So it's really it's a drug.
Opioid is a chemical, and there are many drugs. Like morphine,
right?
Dilaudid. All of those stuff, all that good stuff that we get when we hurt our back.
Percocet is what you're talking about.
Norco, yeah. All this opioid. I think Prince was getting Percocet. I believe it was Percocet that he was getting.
Percocet, but I thought that's for pain. That's for pain, isn't it?
And I get some geriatric patients that they come every month. Now, remember, opioid is not like a blood pressure medication that I can give you refills. Mm-hmm. It's a controlled substance. So you have to come every month and get your prescription.
Why did you let them have them?
Because some of my patients, let's say I have a wonderful lady who is a retired nurse, and her back is such a mess, this poor lady back. And she's in constant pain. She got to sleep with pain, and she's at the level that they cannot do any more surgery.
So you know this, and
Yes,
so
we
you
have
feel,
we have all the information and all the documentation. And sometimes when she have to go to an emergency room or to another doctor, they think she's an addict. The 80-something-year-old lady, they want to treat her like an addict. And she said, no, man, look at my back. You just have to look at her, and you can tell that her back is all deformed. And she walk with her walker because she doesn't want to end up in a wheelchair. So the opioid give her quality of life. She's able to take care of herself. She live by herself.
Well, so what would be wrong if Prince, all right, if he died from overdose, I understand, but if he's taking Percocet, and he's pain, or is that a sin?
No, well, he was 57 years old. And if you see Prince perform, you are addicted to your audience. And he wanted to perform for them. So he wore these high heels. Right. You will see him jumping at 57 years old and dancing and doing all kind of stuff. And he will do it to get the applauses. That's what he lived for.
So you need the drugs to do that?
You need the drug then to afterward, when you are almost dying, you can...
I see. Too much. Oh, I
look at Michael Jackson. You know, he got so excited trying to get work done and what have you, that he will bring the doctor in to put him to sleep, so he can get a good 8 hours sleep without being disturbed.
See, thank you. This is all new for me. You're wonderful this morning, and I'm sure a lot of our listening audience they've never heard things like this, because
opioids is a necessity, and I have no hesitant prescribing opioid when I see a patient in need. Because we want to keep a person pain-free, of course. That's why we went to medical school, to treat people that are sick, that are in pain. And at the beginning, we felt it was okay if you have cancer, and we knew the cancer had penetrated the bone. We felt it was okay to give the person opioids, intravenous or any other way to treat the pain, to make the person comfortable in the dying process. But sometimes we don't feel comfortable when the person need the opioid so that they can work, so they can carry on with their life. So then you keep in the balance those people that need it to maintain their work. And then we try to be very responsible in controlling where we want to decrease the quantity. And then you have two types of opioid. You have what we call the short-acting, like the Percocet, the Norco, the Vicodin. Those are short-acting opioid. So those, like the sugar we give the mice in the laboratory, they go and they lick and they taste the sugar. They keep going more, because sugar get processed very quick. They go for more. So then those medications, they go into your system very quickly, but they disappear also fast. You can get addicted to them. So when you see that you are taking painkillers that are short-acting and you need a lot of them, then you need to go to the doctor and say, now give me a long-acting painkiller so I can move away from the Percocet. So for example, there is a patch called the Butrans patch, that you can put it on as a pain medication, and it will last for a week. So you just change that patch once a week. So the patient with fibromyalgia, that had that chronic pain, that they're suffering with that chronic pain, and they go through the process of the non-anti-inflammatory drug like Tylenol, ibuprofen, prescription ibuprofen, and nothing is working, and they need to move into a pain medication.
But are they an addict?
No, at that point, not yet. Because, you go to the process. It's a pyramid. And in the pyramid, you start with benign thing that we can buy over the counter, like Tylenol. You can buy Tylenol, Aleve, then you go into prescription ibuprofen because it's not enough, of course. And you get patients that say, no, I take 4 Aleves. And it's supposed to be 1 or 2. Say, I take 4 Aleve, and then that help me go to sleep. But that can damage your kidneys. So it's better to work with your doctor when you see that you are taking 4, 8, and high number of belief. And we were talking about addiction also with alcohol. Well, when you take a lot of anti-inflammatory with alcohol, those patients are more prone to producing inflammation of the liver. It's called alcoholic hepatitis. And the people taking anti-inflammatory drugs like this one, they are more prone to damaging the liver, and they will benefit more from a painkiller than over-the-counter medication because of the alcohol that won't go away, fast. So you have to put all of those in the balance when treating, and remember that one addiction brings the other one. So you can be addicted to intravenous drug and alcohol, intravenous drug and smoking, alcohol and smoking. So one bring the other. Intravenous drug, smoking, and gambling.
So, Dr. Mencia, what this is saying to me, though, is it takes a lot of time on a physician's part to be able to diagnose this and to stick with it. This is wonderful. I didn't know that physicians have that kind of time anymore.
Well, then comes the business part of medicine. You have people opening rehab centers for addiction, and it's a big business. They are not really helping the patients. A lot of this rehab, very few of them out there are doing the right thing. It becomes a business. And I recall one of my patients who is I guess you call him a priest, or what would you call him?
A minister?
A minister. He's a minister in church. Right? He's not a priest. And he brought one of the ministers from another church that wanted to talk to me. So I sat down with this other individual, and he wanted to open a detox center. And I said, you've been a minister, you're a man of God. So, but everything that came out of him was the business part. It's like how much money we're going to make and how this is. And I refused. I said, no, I don't want to go in this endeavor with you. And if I do open a rehab center, I will do it properly. I will have, you have to have a social worker, a psychologist, the nurse practitioner or PA, the emotional support. And then one of the things, the way I see it in my book, addiction is a family thing. So if you are addicted, you come to rehab, I'm going to have to get your wife or your husband involved into this so that we can deal together with this.
And the effect it must have on children.
Right. There was a special last week I was watching, it was very impressive on 60 Minutes on opioid addiction. And they brought in this family that, and the way they projected, they got me. I tell you, they got me because, this kid that was a start in high school, and, the only kid that this husband and wife had, and it wasn't a broken family, a very blue-collar family. And they have the only kid they have was a star football player, very popular, got addicted to opioid and, street drugs, and went to rehab several times. And the last time that he went in, and they put him on, they put it on the show that he went to the parents that night, and he said, I'm so convinced that I have changed, that I'm going to become a counselor. I'm going to counsel other kids so that they don't get it as far as I went.
Beautiful.
And the parents, they say, for the first time we went to sleep.
Oh, I have
so
goosebumps.
Relaxed.
That's beautiful.
Well, he went into his room, and he said, I guess he told himself, let me do it one more chance. And he overdosed himself, so they found him dead in the morning.
I can't. Oh, sorry. I thought it was a wonderful story.
It was, to me too.
Yeah.
I'm watching the show, I say, oh, what a wonderful story. Look, there's hope out there. And then you hear that night, then I guess he decided, let me just use it one last chance. And he overdosed, and they found him dead. The parents usually will check on him when they knew that he was probably using, but this time they were so relaxed. they all went to sleep. Like, wow,
So
we have our
serious.
son back.
I just have to go back and tell everyone, hopefully you've been listening every week, but if you've just tuned in, this gracious, extraordinary physician, Dr. Andy Mencia, who founded AGI Medical and Dental Centers. If you happen to be listening and you are addicted to something and you want to get help, you can understand why I would suggest that you go see Dr. Mencia, and he will help you. He has lots and lots of medical specialists, experts all over, everywhere, and he will make sure, if you become his patient, he will make sure that he helps you, and I can really attest to that. So go call Fort Lauderdale for an appointment. Don't be ashamed. He's not like that. He's filled with love. He'll hug you. He will be your friend as well as your doctor. 954-489-1345. Or if you're up in Palm Beach County and you prefer to go there, 561-270-6494. And I just have to always say this. I know what it's like to have someone at home who can't get out. And my mother suffered from that, and I didn't have anyone like Dr. Mencia. But they have a fantastic program for homebound patients. So don't think that you can take care of your family member at home. If you're not a doctor, you can't. You need help. So please do call them. It's not any more money. It's the same thing Medicare pays for this. Please do that for your loved ones. Their website is agifl.com. agifl.com. And so let's continue with this. That was quite a story. So that's what you don't want.
Addiction comes in so many shape and form, Anita and Nina, that you can be addicted to food.
Oh yeah,
so
that's
people,
more for me.
People
that's
can
my
be addicted
problem.
to food, and people that get addicted to food, they go out, and when they put that bread in front of them, they can't stop.
Right, it's compulsion.
They get that compulsion. They keep going. If they put the food, they want more food. So they don't have enough by taking, a scoop or two of ice cream. They bring the whole gallon of ice cream and they start eating, watching TV or whatever they are doing with their life, watching over the kids, but, with the ice cream in their hand. So, addiction has many forms, and until you go and ask for help, it's very hard to treat. You have to take the first step. And then we go through the denial that, no, it's okay, I'm going to quit. One day I'm going to do it. One day I'm going to quit. And, I had a patient that came to me and I said, why you don't have your dentures on? What's going on? And, a handsome 74-year-old guy, very handsome Cuban guy that come to me and, very stoic.
How old was this person?
74. And I saw him and I see him without his teeth. And I say, what happened to you? What's your teeth? You forgot? He said, no, they broke and I need to fix them. But come to my dental department. We can do care credits. And if it costs you whatever, $600, $800, as long as you pay within a year, you're going to be okay. He said, I cannot get care credit. I'm a gambler. Now, he's been my patient for a long time.
See,
so he told me
this.
I'm a gambler. So I owe so much money out there. They just kept giving me more and more, and I kept playing, thinking that I'm going to win, that this time it's going to happen.
Of course.
And I cannot even afford to get my denture.
And I know you, and I know what you
so
did.
I said, yeah, exactly.
I know you made a denture for him, but
yeah.
Oh my heavens! So he's a gambler, and that's his addiction, and
So
we're about to run out of
addiction
time.
to
Also,
food, so food can kill you.
well, the one thing about you have nutritionists there.
We
that
have
can
the
help.
nutritionists, right?
And now
That's
we have
why,
a detox program
Yes.
that Nicole has worked on.
Yes.
Right?
Yes.
You have it all. You must be so proud of yourself, and you really have gotten something that you dreamt of. We all
Yes.
admire you for that. I especially, and Dr. Mencia, the people who read the articles and they know you. I think, isn't it time that we have a big party at one of your places again?
Yeah, yes, it is.
Why
time,
don't we do that? Spring.
And it's
Spring's
like,
here.
yeah,
Come on, Ina, let's work on that. People want to know you. They want to see you. We have to do that.
Tomorrow I'm meeting this lady. Her name is Anastasia the Great. She's an artist. And when it comes to art, you have to imagine the whole, like my dream is not complete yet. I want to see like the pharmacy. You know how you get those elderly patients that come in, then they have to go to a pharmacy.
Yeah, we're going to do that. But the show has to close because, because we finished. Thank you, Dr. Mencia, as usual. It's so wonderful to have you on our show. 954-489-1345. Until next time, goodbye. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.